Good evening. Welcome to Liberty and Justice for All. Tonight we get to talk again about one of my favorite subjects, alternative medicine, anti-aging, and I always, I've said because of my experience, I've become involved. I'm obviously not a doctor, not even close, don't want to be, but I've got two of the finest here tonight with me. And we're going to, actually this is not going to be my show tonight, it's going to be theirs, because these two gentlemen know what they're talking about. They've got a track record. Anytime you go anywhere in this area and you ask for a very knowledgeable homeopathic or naturopathic doctor who can treat the body so that the body allows itself to heal, the name of Dr. Gerber and Dr. Schallenberger always come up, always. What exactly is chelation therapy?
Michael, you're on.
Big topic. Chelation therapy spans a wide variety of chelating agents, things that pull bad things out of the body, things you don't want in the body, particularly heavy metals like lead and mercury and cadmium and aluminum and sometimes tin and excessive copper, but primarily heavy metals. But more importantly, the chelation you're talking about for vascular disease really involves calcium. We all fill up with calcium in our arteries. The aorta, your major big artery that comes out of the top of your heart, when you're 10 years old, you have about 5 parts of calcium in it per gram of tissue. When you're 84 years old, it's almost 1,500 parts of calcium per gram of tissue. So we all calcify. We all turn into a rock. And, Grandma says, how are you? Hello, Grandma. Yeah, I'm all calcified. Her neck is calcified. Her back is calcified. Everything's all tight and shit. So, but this happens to our vascular system, and it narrows, and there's fatty parts of the plaque that plug us up. But there's a lot of calcium. And so we lose the elasticity of our arteries, and we lose the ability to get that circulation down to the nooks and crannies of our body. So chelation pulls out calcium and heavy metals, and you just urinate it right out.
Just like that.
It's an IV treatment, lasts an hour and a half. It's been around at least 50 years.
Why wait until you're having the symptoms?
Right.
I tell every one of my patients, you're 60 years older, you should get 20 chelation treatments, period.
Right.
Let's just go in. I mean, you've been around the planet for 60 years. You're lucky enough you made it this long.
Right.
Okay? You didn't get shot. You didn't get hit by a car or something. You managed to make it to 60 years. Your arteries have a lot of calcium in them. You're feeling fine. Everything's okay. Well, that's a good reason to go in there and pull the calcium out.
I mean, there's parts of my body that didn't work. But everything, I'm like 10 years younger than before I had my heart attack. And this stuff creeps up on you. A lot of people think they feel good, but when actually they've slowed down a lot, they just don't realize it. And so that's the strongest point that I could ever make is the time for these two doctors is before you're sick.
Most people, they think, I'm old. I'm supposed to feel old.
Well, we've been taught that.
We're trying to like get the word out that you might be old, but you're not supposed to feel old.
Well,
you can feel young and be old.
All this stuff they're feeding us. I mean, we got crap in the water, we got it in the air, we've got it. I mean, some of the wild-eyed people are having it sprayed on us. I mean, I don't know. I have my suspicions, but
I think this is important where you take, some basic nutrients, antioxidants, like vitamin C, for example, is the universal detoxifier. It helps so many things be brought out of the body. Sulfur compounds, glutathione, amino acids like cysteine, methionine bring out heavy metals, and we're all exposed to lead and cadmium and mercury, and from our teeth, the fillings give us, a lot of mercury in most people, and we measure this all the time. Heavy metals are like a big thing that we measure. We have new techniques by doing challenge tests that we can measure the mercury in people's urine. And the mercury is all bound onto connective tissue, and it holds on the lead and the cadmium and the aluminum. And we can pull this off the bound connective tissue and demonstrate huge amounts of heavy metal in people. But taking your basic antioxidants, vitamin C, vitamin E, pycnogenols, these things protect you.
Now, I shouldn't do that. I might die. But the older we are, the more exercise we need. It's sort of like, eat right, get some exercise, drink some water, get some sleep, get some sunshine, have some fun, have a good attitude.
Right.
And, that's 90% of it right there. You don't have to be a doctor. You don't have to be a genius. It's just sort of a matter of a little discipline maybe, and doing that in your life. But that's a whole lot. Then after that, then we can work on top of that and do some of these extra things that we're talking about.
Right.